Today we'll be discussing about insulin initiation, when and whom. So I'll be discussing a patient who is a lady who has got diabetes, type 2 diabetes. And she's been on 3 drugs. She's been on glimepiride, metformin and sitagliptin. And she continues to be uncontrolled. So Srimati is having a body mass index of 25. She is overweight and she's got an HbA1c of 9%. Her blood glucose is elevated. She does some amount of exercise every day. So let us consider situations in which insulin is the best choice of therapy. One is if the person is on at least 3 oral hypoglycemic agents and still the glucose levels are not under control. A certain patient may have some adverse effect related to the oral hypoglycemic agent. Example, an SGLT2 using patient may have a genital mycotic infection, and so you cannot continue to use the medicine in that patient. People with acute events like a myocardial infarction, a person who is admitted in the intensive care unit, or someone with hepatic or renal diseases where oral hypoglycemic agents cannot be used. So these are the common scenarios where we like to use insulin. So we have decided to start the patient on insulin. So when you decide to start the patient on insulin, it is important to understand which insulin to start. One of the easiest methods to initiate insulin is to use a basal insulin like glargine. You can start the insulin at 10 units per day, and based on the fasting blood glucose, you can continue to adjust the insulin till you reach a target fasting blood glucose of something between 80 to 130 milligram per deciliter. So at that point, a significant number of patients with type 2 diabetes will have their glycated hemoglobins coming to near normal levels, close to 7%. So in people with type 2 diabetes, controlling HbA1c is very important. Studies like the DCCT in type 1 diabetes and the UKPDS in type 2 diabetes have shown this convincing benefits. So treatment with insulin and reduction in A1C by 1% itself can cause improvements in microvascular complications like diabetic retinopathy and nephropathy, and also in macrovascular complications. And in fact, if you look at people with type 2 diabetes on insulin, you would see that there is a general improvement in well-being also for these patients. So as a treating physician, it's very important to think about certain aspects when you start patients on insulin. So what is the initial starting dose of insulin? Second one is how do you adjust the insulin to achieve good glycemic control? We realize that a lot of patients get initiated on insulin, but the intensification or adjustment of insulin to reach good glycemic control is very important. The second one is whether you want to go on a once daily insulin or on insulins which can be given twice or thrice daily. So this is also a very important decision based on the blood glucose and the patient preference to decide what sort of insulin should the patient take. Third one is monitoring of blood glucose. So monitoring of blood glucose is extremely important in people who are on insulin. So it's very important that as a physician treating a patient with type 2 diabetes on insulin, you should be insisting that your patient start monitoring the blood glucose, either with a home glucose monitoring or with a continuous glucose monitoring. And this can help adjust the dose of insulin so that the patient reaches the good target of blood glucose control. Thank you.